Hi, everyone. I'm here with Shayna Babb from Medical Mamas. Shayna grew up in Orange County, California. She and her husband have two young children, Riley and Braden. Shayna graduated nursing school from Saddleback College in 2015 with an associate's degree in nursing and began her career as a nurse in an adult cardiovascular unit. While working in that unit, she obtained her bachelor's degree in nursing from Chamberlain University. 6 months into her career working with adults, she realized her heart was with children and started working in a pediatric multi-specialty medical unit at Children's Hospital of Orange County, where she spent 5 years as a bedside nurse before pursuing an opportunity to work on the float pool unit, where she moved through every unit hospital wide. And then she got hired into the vascular access team, which is a highly specialized unit of nurses who staff the entire hospital, putting in IVs, central lines, and arterial lines using ultrasound guidance. Very cool. She also started this business we're going to be talking about and how we got into touch, which is called the Medical Mamas. We're excited to have her share her knowledge and education with everybody here, parents, caregivers, which is her mission to help equip and empower parents in the event of a pediatric emergency. So welcome, Shayna.
Thank you. I'm so excited to be here. Looking forward to today and talking all things pediatric emergency and how to equip and empower families on how to be their child's best advocate.
That sounds incredible. Can you tell me what inspired you to do this? I mean, I'm sure you saw so many things in the units. I know you were in ICUs, which is intensive care units, seeing all types of probably pretty horrible things, pretty uplifting things, and inspiring. So, yeah, can you tell me what brought you into this?
Totally. I feel like, honestly, such a huge part of my mission really stemmed from just during COVID times. I felt like families were either mortified to bring their kids into the ER because that was not the place you wanted to be, or they went for no reason at all, really. It's like you had a cough or a sore throat and you were showing up in the ER, and it's like, you do not want to be here in this crazy time. And so I felt like so many families just lacked the education on when to escalate care for pediatric illnesses. And so that's kind of what started this idea in the back of my head. I started Googling like pediatric education and like illness education, and there was nothing in my community. And I'm based out of Southern California, which I would say is a pretty big, like, it's like the mecca of education and moving forward information. And I was so devastated to hear that there was no really community education. And so that was the beginning of this idea. It was 2021, and I was like, I got to do something to help these families. And then in August of 2002, when I got hired into the vascular access team, is really when that idea was like, okay, now I really have to do something, because I spend anywhere from like 20 to 30% of my shift in the ER. We get sick kids. They have a hard time getting access on them. They come in dehydrated. We get a lot of babies. And again, so much of the stuff that I was seeing in the ER stemmed from lack of education. Parents not knowing when to bring in their newborn for fevers, or parents not knowing how to manage their kids vomiting and diarrhea, or not knowing signs and symptoms of when to escalate care with respiratory conditions. And that's what solidified it for me. I'm like, this is it. I'm starting this business, and I'm going to provide this community the education they need to bridge the gap between what happens at home and what happens in the ER. And so that's kind of where the Medical Mama started.
That sounds so incredible. And I couldn't agree more about that lack of education and knowledge. I mean, we always say kids are not born, babies are not born with a manual. And it's like, you just want to hand them that and say, these are all the things you really, really, really need to know. But that's hard. That's hard to do. This is a lot of information, and it's scary to be a parent sometimes. So to have that extra layer of support and education is very important. You touch
Totally.
on a lot of things. I'm just going to clarify for listeners what is what is access, so they know
Oh,
how much work you did, because it's tough what you were doing.
yes, such a good question. So, pretty much standard when you bring your child into the ER, your child gets admitted into the hospital. We have to put a plastic catheter, like a little straw, into a vein, in order to draw labs, in order to give fluid, and some IV medication like antibiotics, steroids, that kind of a thing. And so when children come in severely dehydrated, or maybe they're getting like they're starting to progress in their illness, basically what happens is the blood shunts from the arms to the center core, because the body says, in an emergency, I don't really need my arm, and the veins get teeny tiny and they get really, really small. And so although our ER nurses and our hospital nurses are so good at putting in standard IVs. When kids come in really sick, sometimes you can't see a vein or you can't feel a vein. And so when you can't see and you can't feel, I get to use special eyes in an ultrasound to find a vessel or a vein, and I get to place an IV using ultrasound guidance. And we also use that same technology to place central lines. They're called a peripherally inserted central catheter. So it's a catheter that starts in the arm or the leg and ends up right by the heart, to give stronger medication or medication to help with sedation or blood pressures, or really strong antibiotics. And so we use that, we place those using ultrasound guidance, as well as arterial lines to assess like arterial blood pressures and stuff. So our team is like super skilled and very, very, very needed by the entire hospital. And with that team, like I said, I service the whole hospital. So I've taken care of like 500 gram 22-week gestation babies, all the way up to like, 20-year-old oncology patients that have pediatric oncology processes. And so I really get to see it all. And that's like what I love about what I do, is it helps so much in educating the community because it goes hand in hand with one another.
Yeah, that's incredible. Super specialized, like you said, super needed. And as a parent, if you ever landed in ER, like, you don't want your kid having to face a needle poke more than once, really. So you are usually super grateful. Parents, we see, very grateful to have a skilled team
Oh,
to be
yeah.
able to do that as effectively as possible.
Yeah, we're like requested now. Parents
Oh, I'm
know,
sure
like
they know.
young families are like, do
Out.
not poke my kid, call big team. So
Yeah.
yes, absolutely.
Awesome. So you mentioned several things that landed in the emergency room that are probably avoidable, and I think this is what you do educate in. You could tell me what I'm wrong or right about here. I know you have a pediatric 101 course. Is that right?
Yeah, so the standard medical mamas course, and I'll talk a little bit about the name. Obviously, the name stems from the fact that I'm a mama with a medical background, and that's like
Mhm.
the name. And so all the nurses that I bring on to teach with me are all moms, so they have that mom heart, that mom gut. They want to empower moms to listen to that gut, that little pit in the bottom of your belly. But they're all medically trained, so they're nurses. They have a nursing background, and so that's kind of where the name stems from. And then in terms of what I teach, so a standard medical mamas course encompasses infant, pediatric, and adult CPR and choking, because at the end of the day, God forbid, in the event that a caregiver or a loved one ends up having their own cardiac event at home where they go unresponsive and they don't have pulses and they're not breathing, it becomes a medical emergency. I felt like I couldn't teach a pediatric 101 course without adding in the CPR and choking portion. So my entirety of the course includes, like I said, infant, pediatric, adult CPR and choking, plus the pediatric 101 course, which encompasses the most common ailments that I see kids come into the ER for: fevers, dehydration, vomiting, diarrhea, respiratory conditions, head traumas, concussions. And so it's a full encompassing, like head to toe pediatric course. But like I said, I couldn't leave out the CPR and choking portion. So all families leave having hands-on practice with my mannequins and full education on CPR and choking as well.
Wow, that's incredible. Super thorough too. I'd love to I'm sure that like a lot of those things piqued parents' minds and like, oh, like I would want to know about this. I would want to know about this. What are like some absolute pearls? I might just pick a few topics out of that. So, ways to avoid dehydrations and signs that that's going to happen, but could be avoided. What would your advice be there?
So if we're talking like a tummy bug, unfortunately, like I always tell families, puking kids are absolutely miserable. And like my least favorite bodily fluid out of all the things that I deal with is for sure vomit. So puking kids are not fun. My biggest piece of advice when it comes to kids that have a stomach flu, is number one, typically the vomiting is acute and lasts anywhere from about 12 to 24 hours. And in those moments, it is crucial that we give frequent small sips of water or fluid. You don't want to just let your kid douse a whole, Stanley or Hydro Flask full of water, because they're just going to puke it right up. But you want to be giving about 1 to 2 ounce volumes about every 10 to 15 minutes. And the best way to monitor your kid's hydration status at home is their urinary output. So if at any point your kid goes 8 to 12 hours without having urine output, at that point is when I would raise concern to your pediatrician. And depending on the time, consider going into the ER if your pediatrician's office is closed.
Perfect. I get this question a lot. How do you feel about juice and ice pops when they are, yeah, in that stomach bug?
Such a great question. I think it absolutely plays a role in vomiting and diarrhea, dehydration picture. I think it's very important that we realize that extremely concentrated forms of juice actually feed that gut bacteria to overproduce because bacteria feeds off sugar. However, I think it's very important that we maintain a child's sugar levels. And so I think incorporating something like a 100% like organic apple juice diluted with water at about a 50 to 50 concentration, and or implementing something like coconut water that has a ton of electrolytes, or something like a Pedialyte is a great option to maintain their blood sugars, because the more kids puke, the more option or chance they have of getting lethargic. And so those blood sugars help to maintain that lethargy status and avoid them becoming lethargic. But an over amount of sugar, I think, also kind of feeds that gut bacteria and can make things worse. And you want to avoid anything acidic because that can just be really harsh on their belly. So that's my biggest piece of advice. And I hope that you guys agree with that.
Yeah, absolutely. I think we're always counseling between like, don't give them sugar but we need to hydrate them. So I think there's a healthy balance there of like, let's prioritize this acute event. We just need to get fluids in. Sometimes it's whatever they will take, and then we just back off of it as the disease process progresses. So to absolutely agree. Okay, so I think another big emergency that hopefully we could avoid the ER and teach parents about is these respiratory viruses where the kids really get into trouble. These are very scary to me, with my own kids, even knowing what I know. So what are signs parents should look out for? How do they avoid the ER for these viruses?
Yeah, such a great question. So I think I always teach in my classes the viral process when it comes to respiratory conditions is vastly different depending on a child's age. Okay. So going from age, let's say 0 to 12 months, considered like infancy, these kids are obligatory nose breathers. What the heck does that mean? That means that they are created to breathe through their nose exclusively so that they can open their mouth to take a bottle or a breast. So in the acute beginning phases of any signs of a respiratory condition, runny nose, congestion, like that snorting kind of breathing, at any initial sign of a respiratory infection for infants, my biggest piece of advice is hydrate, 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 and clear their airway, meaning suction them when it matters. So I always tell families, infants that are obligatory nose breathers, and like I mentioned, created to breathe through their nose so they can feed with their mouth, it is crucial to suction them before feeds and before bed, because we all know we're all trying to get a little sleep, right? So before feeds, it's crucial that you suction your baby so that they can have a clear airway so that they can breathe, suck, swallow. If you do not suction your infant before a feed and they're super stuffy in their upper airway, they're not going to take an adequate feed. An inadequate feed, can lead to dehydration. Dehydration, like we mentioned just a minute ago, can lead to low blood sugars and lethargy. And a lethargic baby is not a healthy baby. We do not want our babies to get lethargic. Yeah. So when it comes to infancy, my biggest piece of advice for you would be to suction when it matters, before feeds and before bedtime, and maintain their hydration. Like I mentioned, making sure they're having wet diapers, they're peeing, and they're taking their normal volumes of feed. As we progress in a respiratory condition, whether it's infancy or a young child, toddler age, or even a bigger kid, I always also tell families to check on like YouTube on signs and symptoms of increased work of breathing. It is crucial that parents can recognize mild, moderate, and severe signs of work of breathing for their child's age group. So if a family has a 6-month-old baby, I always say hop on YouTube and search 6-month-old increased work of breathing so that you have a physical presentation of what that looks like, so that you know when to escalate care. And I always tell families that even at the initial start of increased work of breathing, so if at any point you notice your child's having nasal flaring where their nostrils are flaring in and out, that's not normal. Or maybe they're pulling or tugging in their neck area or in their ribs, or they're breathing fast with their belly. Those aren't
Hmm.
normal breathing patterns. So if at any point you recognize this during even the beginning, day one of a respiratory infection, I recommend recording it with your phone so that when you take your child to the pediatrician or you go on Blueberry Pediatrics, you can upload imaging and video of your child so that the doctor has a very black and white presentation of what your kid looks like. And that can help them navigate the plan of care. It's hard as a medical provider to just kind of have it be hearsay without seeing physically what's going on. And so I think that that's a huge piece of advice that I give families that has been so helpful. And then the last thing I would say is just trust your gut. If at any point you're concerned about your child's well-being and they have a respiratory infection, typically respiratory viruses peak around days 3 and 4. So if around day 3 and 4, your kid is just not getting better, you're worried about them, they look like they're miserable, obviously they're having any color changes, there's a reason that there's an emergency room, right? And I think that there's a reason that we have urgent cares, and it's to get your child the care that they need immediately. But my hope is that you would never have to do that because you're educated on what to look for before it gets to that point.
Yeah, absolutely. Because there are things you can do before getting to that dire stage of the respiratory distress that really needs the ER support, where they have to give oxygen or they have to do even more, give even more support, whether it's with the breathing or medication. So there's things in the doctor's office that you could use, or maybe you even have at home, like breathing treatments that can alleviate and make the kids feel better and breathe easier to avoid the escalation. So all that is, yeah, perfect, great advice. All right, so we hit respiratory, we hit the GI, the vomiting. What's another big one that you see that you think we can teach a little bit to avoid?
Fevers are
Yes,
probably one of
let's
the
do it.
biggest topics.
Okay.
Okay. And I think like what I have to say about fevers is I tell parents, regardless of anything with fevers, treat your child, not a number. And I always tell families, I have a 4.5-year-old and a 3-year-old, and both of them have had 104 fevers and they've
Wow.
had 101 fevers, and they look
Hmm.
totally different. And sometimes the 101 fever can look worse than the 104 depending on the virus. Did
Hmm.
I take it in the armpit? Did I take it in the mouth? Did I do a rectal temperature? Did I do a temporal temperature? Like numbers can slightly vary. And so when it comes to fevers, I always tell families treat your child, not just focus on a number. People ask me all the time, like, at what point should I go to the ER for a fever? I'm like, it depends on your kid's presentation. And what do I mean by that? So I go back to my kiddos. My son, we all got COVID in 2021, and my son had like a 103-degree fever, but he was honestly acting okay. He was still eating. He was not lethargic. He was playful. He was still interactive. He wasn't like miserable and plumped over on the couch and just like depleted. Okay. Same kid about 2 months ago had a 101-degree fever from a severe ear infection, which like I did not have Blueberry at the time to take my otoscope. So I had to take him into the pediatrician's office, and he had like 3 days of like 100.5, 101, 101.5 fevers. But I was like, I don't know. He's like, has no other symptoms, like no congestion. He's not vomiting. Like, I'm just going to monitor it. Well, it got to a point where he was absolutely miserable at 101, just screaming
Hmm.
bloody murder. That's a kid that I'm going to take him in to be seen by a doctor. He's miserable. He's like not wanting to, eat or drink. He's wanting to sleep. The kid hasn't napped in over a year. So those symptoms that he was presenting with were abnormal for him. I'm going to worry about that fever. Sure enough, took him to the pediatrician's office. He had like almost pus coming out of his ears because his ear infection was so bad.
Yeah.
But that's what I mean when I say treat your child, not a number. When we all got COVID, we never even went into the doctor because I tested from home. I knew we had it, and I maintained his hydration, and he was totally fine. And so that's when I say with fevers, I think parents like tend to freak out about them, but really, as long as you're able to maintain your child's hydration, They're peeing at least once every 8 hours, ideally more than that. And they're not showing signs of lethargy. I don't freak out about fevers. Now, one thing I do tell families is if your child has had a fever for 48 hours that has not broken, or a 72-hour fever that comes and goes, that's when I would escalate care, because at that point, I would suggest having a pediatrician check your kiddo's ears, listen to their lungs, check their belly, like make sure that their physical assessment is presenting normal. Because at that point, it's like, why is this kid having a fever for this many days and it's not breaking? And so that's like my biggest piece of advice. But with fevers, kids compensate differently. When we have fevers and our body breaks a fever, the number one way we know that it happened is why? Because we sweat, right? And we lose fluid, and that's how our bodies cool ourselves off. And unfortunately, in the pediatric population, their compensatory mechanism, or their way their body compensates for a fever, is different than adults. And typically it happens internally, and it has something called insensible losses that we can't see to the human eye. Their body's working harder. Their hearts are pumping faster. Their lungs are working harder. They're breathing quicker. They're losing fluids internally without being able to really visualize them. So when it comes to fevers, the number one way to stay out of the hospital is to maintain their hydration. Because if we're not on top of these kids' fluid status when they're having fevers, their body's working in overdrive to compensate, and they lose fluids at a much more rapid rate than you or I would.
Yeah. I mean, all of that is exactly what we tell our patients too, that treat your child, not the number. I can honestly say, don't take my kid's temperature even when they feel hot. Like, I really just go by their appearance, and that tells me everything I need to know. I would add maybe one thing: when there's an identifiable cause, because I think this is the differentiator. Do I have to go to the ER, like you said, for the number, or for how maybe it's 2-3 days that I've had it? If there's a high fever and we don't know why, that's a little more concerning, rather than they are snotty and mucusy. They've got a post-nasal drip causing a cough. They're whiny and they're just uncomfortable. Like, that's a virus. It's most likely a virus. There's a ton of respiratory viruses. I mean, we just got through a crazy season of them.
Crazy.
And that is the reason the child has a fever, most likely. And it comes with the territory. And so they might be miserable. You try like a Motrin or like an ibuprofen or an acetaminophen, Tylenol. One of the other reassuring things I find is that if they perk up, they feel better with the medication. That means to me, like, okay, they're fine. We can wait several hours, see what direction this is going to go. But you always have like the interim of like, let's go for a physical check with the pediatrician if you need it. And then, as you said before, I think is like one of the most important points is trust your gut. Parents know, you know your kids better than anybody. If you sense something is wrong, something's wrong. Like, go get checked. And even if everything's fine, like best case scenario, great, everything's fine, you get peace of mind, which is invaluable. Like, there's no price on peace of mind of a parent to know that you can sleep knowing your child is okay.
100%. And I think too, like what you say about trusting like your gut is like that. I cannot tell you the amount of times that parents trusted their gut and it genuinely saved their kid's life. Like,
absolutely.
And even it goes both ways. Like I took care of a mom. Gosh, it was probably about 6 months ago. I took care of a kiddo in the ER actually. He was about 13 years old, and he was playing tackle football. He got hit playing football.
Oh.
And obviously got a concussion. Mom did her due diligence. Kiddo got checked by a pediatrician, cleared him, no concussion. In the acute moment, had no signs of any sort of head trauma, other than like, yeah, he got hit, he's got a little headache, but it wasn't like a full concussion. About 10 days after the head trauma, he started acutely vomiting, and mom was like, what the heck? Like, there was nobody else in the family got sick. They have a large family. Right. They all eat the same food. Mm-hmm. It wasn't normal. And mom called pediatrician, and pediatrician was like, oh yeah, it might just be like a tummy bug, because again, 10 days after a head trauma, you don't necessarily,
like, who would think, yeah.
usually it's like that acute 24 to 72 hours that you think head trauma. But mom was like, I don't know. I don't feel good about this. She brought him to the ER. We scanned the kid and sure as heck, he had a major concussion. And she
Right.
trusted her gut, even though it didn't really fit textbook answers to head trauma. And it didn't really, the pediatrician was super thorough in the initial visit. And it was hard to, for them to assess, in an outpatient setting. And so mom was like, I'm just going to get a second opinion. And we admitted the kiddo and had him on, like neuro precautions
Neurochecks.
and
Yeah.
brain rest, and so I to that, like, I just think that empowering parents that they have absolutely everything that they need inside of their gut and they know their kids better than any medical provider out there, and empowering parents to trust that gut is like so much of what I stand for, because I have seen moms and dads advocate for their kiddos and save their babies' lives because they spoke up. And then I've
Ooh,
seen
got the
other
chills.
families,
Yeah.
yes, I've seen other families, that are a little bit more timid. And I'm like, gosh, if they only would have spoken up, or if they
Right.
only would have continued, we may have been able to get this child care sooner. And so that is 100% what I preach. And that's why it's in my mission to educate, equip, and empower parents to be their child's best advocate.
Yes, I love that. All right, so let's move on to choking. This is something that I mean freaks me out. I have three kids, and trying to teach them how to deal with solids. Even now, I hand my kid, the baby carrots. I mean, my littlest one is 2. Like she can handle it. She has full mouth of teeth, but like I'm still
Yes.
slicing, and because it still scares me. So, what's some good advice to prevent choking that you could give parents?
Gosh. So I'm going to talk about, are you familiar with baby led weaning?
I am.
Okay. Well, in case you're a viewer and you have no idea what the heck I'm talking about, and every dad in my class is like, I'm sorry, baby, what? So, baby led weaning is kind of the new way of solid introduction. And so, every class I teach, I talk about baby led weaning because number one, I think that there is a huge societal push on using baby led weaning. And I think as a new moms have a lot of pressure in implementing baby led weaning, even if they are not fully comfortable with baby led weaning. So here's what I have to say about solid introduction, and then I'll answer your question. So, number one, please do not let anyone push you, like tempt you, or try to like bring you along the baby led weaning journey if you do not feel fully confident in helping your child if they choke. Okay, so that's like my biggest piece of advice is, if you're not comfortable managing a choking child, baby led weaning should be put on pause and we should start with purees. Number two, learn what to do in the event of choking. So take a course. That's my little push for the medical mamas course. But I think that every parent implementing solid should feel fully confident in choking
Hmm.
maneuvers for that child's age, as well as performing CPR. Because guess what? If we can't get that object out of an airway, we're going to end up performing CPR. So before solid introduction, I really recommend every parent having CPR and choking education and feel confident in their abilities. And then when it comes to implementing solids, gosh, I would say learn how to prepare your child's food in a way that it is safe for them in the event that they were to choke. It's not going to fully occlude their airway. So 6 months is typically when pediatricians recommend starting solids for a baby. You want to make sure that they have really strong head control, because if they've got a floppy neck, that food's going to be flopping around in there. So you want to make sure that they're able to sit fully unassisted, and that they have an interest in food. I have such good news. Your child will not go to college on a bottle or a boob. And your child also will not go to college on purees. And so when it comes to implementing solids, make sure they're interested. Some kids at 6 months could care less if you're eating dinner at the table. They're just not ready. You don't have to push them. You want it to be a positive and fun experience, and it should not be stressful and overwhelming. My other big piece of advice when implementing solids is just as a reminder, breast milk and formula should be the primary source of nutrition for a child age 0 to 12 months. Any solid introduction really should be just for fun. So it shouldn't be that they're trying to get the caloric intake from those solids before breast milk or formula. You shouldn't like not give your kid a bottle so they'll eat more solids. Feed your kid their breast milk or formula first, and then secondarily offer solids after 6 months when they're ready and you're cleared by your pediatrician. Now, when it comes to solid preparation, like I said, you want to know what's safe to give your kiddo. So I obviously would not recommend doing anything like hard immediately when they have no teeth. So you want everything to be very, very, very soft and gentle, and then avoid anything like round because that's airway issues. So, like I mentioned, when it comes to choking, no matter how old your kiddo is, my biggest piece of advice is just be mindful of like the size food you're giving them. Be watching your kiddo, and don't leave them unattended when they have food. So I don't care how old your kid is. I think that regardless, whenever kids are eating, just be so mindful of what they're eating and that you're present so that God forbid they choke, you're ready to react in that moment. So get yourself educated on how to perform choking maneuvers for kiddos and people of all ages. Because at the end of the day, God forbid your husband chokes, you want to be able to help them, or your dad, right? Or some member in your family. And so that's my biggest thing when it comes to choking, just being mindful of the shapes and the sizes. And then one of the biggest questions I get asked is about the dechoker / life back thing.
Yeah.
If you guys have not heard about this, it is all over social media. I
Yeah.
like wish that I did as good of advertising as they do because it's like everywhere. Anytime I scroll, it's like sponsored on my social. But for those of you that don't know it, I call it like a reverse plunger. So not that I'm an expert in plunging a poopy toilet, but when the toilet gets clogged, you push in and it like force negative pressure to push that object deeper down, right? And so you're plunging, and it pushes the toilet paper, whatever, stuff deeper, and then it flushes. The life vac or the dechoker is opposite. You push in and there's a one-way valve that comes out the side and it actually sucks out so that you pull that object out of the airway and comes out. Now, what do I say about the dechokers? Because I literally get DMs all the time. At least one person
Yeah.
in my course always brings it up. My biggest piece of advice comes from a point of empowerment. Okay. There are a million tools, there's a million products, things that you can register for, things that you think you need. But here's what I'll tell you. In the event of an emergency, you do not have time to leave your choking child, run to your medicine cabinet, grab your dechoker, open it up, fumble around, figure out how to use it. Which one do I push? Which one do I pull? What mask do I use? You have to be able to tend to your choking child. And so my biggest piece of advice is you always have your two hands and you always have the knowledge that I will give you in my courses or in a CPR or choking course in order to intervene in that moment. And so my biggest piece of advice and what I tell all my families is if you have bought a dechoker or you have purchased a life vac, please open the box and play with it before you need it. Because if you're anything like me, when I got my air fryer, I either had raw chicken or burnt chicken. And there was no good chicken until about 10 times into my use. And you don't want to be messing with something in a life or death emergency state and trying to fumble around with how to use it. So if you have one, no shame, but just know how to use it so that you are prepared and also know where it is. And if you leave your child in the care of someone else, make sure they know where it is or make sure they're trained in how to perform CPR and choking maneuvers.
Great. Thank you for that information. That's great. Okay, the other big topic that I think parents are always wanting to know about is CPR. What do you think, without having learned an entire course worth, what's like the main things that they should know without having yet taken that, which we advocate for, but what are things that you could teach them right now?
Yeah, so great question. Bystander CPR increases the chance of survival by 2 to 3 times. Like it is, if we can get return of spontaneous circulation or ROSC at the beginning of a cardiac event or en route to the hospital, survival likelihood goes super high. And so I am a huge advocate for obviously taking a CPR course. My biggest piece of advice to you in the event that God forbid, and I hope and pray that this never happens to anyone who's listening to this, and that you never have to experience this. But in the event that you do, number one, focus on your compressions. That's the number one most effective point of CPR is compression. So you want to focus on your rate, 100 to 120 compressions per minute, your depth, push very deep, and your recoil, allowing the chest to come back to its normal position between compressions. And
I'm
if
just going
you
to
don't,
clarify. So
yeah,
compressions are when you're actually pushing on the chest to beat the heart for them.
exactly. Yeah,
That's what compressions are.
exactly.
You see the put the
Yeah.
heaving on the chest. Okay, go ahead. Sorry to
Exactly.
interrupt.
No, thank you for that. So yeah, compressions are your number one focus. So push deep, push hard, push fast. And don't feel like you have to put your mouth on everyone. Okay. During COVID times, there was different educational standpoints that just providing compressions alone can save somebody's life. And so don't feel like, God forbid, you're walking on the street and you see someone collapse, that you have to even touch them. Okay, so we don't have to be a hero to everyone if we're not comfortable or we're not in a safe environment to be able to help somebody else. Just calling 911 is crucial. But in the event that it's your child or a loved one or a family member or someone that you feel comfortable putting your hands on, you do not have to go mouth to mouth with a stranger. And so just doing compressions alone can significantly help that person's chance of survival, and intervening in the moment, not waiting. The worst thing that you can wait in the event of a cardiac emergency or an arrest is waiting to do anything. Typically, when we have kiddos that come into the hospital, there's been multiple cases where kids go down unexpectedly. They get sick, they stop breathing, or they have some sort of cardiac event at home.
Hmm.
And parents hear a thud upstairs. They run upstairs, they call 911. And by the time EMS arrives, like it's unfortunately too late. And if parents don't intervene in that moment, that's truly the difference between life or death. So intervene quickly, call 911, and begin compressions. That's my biggest piece of advice.
Perfect. So I'm going to try and turn this terribly morbid a conversation about kids in that situation, but let me ask you, do you use the Staying Alive song as a way to with the, what's it called? The rhythm?
Yes. So, I'm going to age myself. And I would not say that I'm old, but it's sad that I've taught classes in Staying Alive. People have no idea what that song is, but
No!
yes, I
I
know.
aged myself.
So what I will say is Baby Shark is one of the
Oh my
newest.
God, that's hysterical. No way.
Yes,
So wait,
Baby
what we're
Shark.
talking about is the rhythm that you use in order to do compression. So we used to be taught like you're pressing on someone's chest, beating their heart, sending their blood around their body. So we used to be taught ha 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 ha, staying alive, ha, ha. And like it's perfect, right? But now
Yeah.
apparently we're doing Baby Shark.
Baby Shark, do 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 do. It's the same beat. So I will say, the new generation of moms and families and all these young parents coming in, Baby Shark, sing Baby Shark, save your baby's life. I know it sounds morbid, and I hope you never have to use this knowledge, but I will say that it's the same rhythm, and that's how quickly you want to compress.
Great. Wow, that I didn't know. Okay. Thank you for that. Let's talk a little bit about drowning prevention. I know what you could actually tell me the stats and why this is so important.
Yeah, absolutely. Drowning is the number one leading cause of death in kids aged 0 to 4. And if there is anything outside of CPR and choking and pediatric illnesses that I'm more passionate about, it's drowning.
Mhm.
Drowning takes more kids in our hospital every single year than any illness I see. I think last summer I took care of 13
Oh, I
drowners.
don't want to
And
hear a number. Okay. So
yeah, it's
terrible.
it's horrible, and these are the kids that unfortunately didn't survive. Now, I'm not talking
Oh.
about the amount of kids that God like was watching over them and they
Yeah.
survived it and got to go home to their families, or unfortunately survived it with some sort of brain effect,
Trauma, yeah.
a trauma of some sort. Yeah. And it's like a hypoxic event, meaning they lost oxygen to the brain. But drowning happens, and it happens quickly. And I think the scariest thing about it is that it's silent. So there's never signs that it's happening. It just happens. And it's something that I am so passionate about. Like I always said, I'm going to start a nonprofit, and it's going to be all about drowning prevention, because this is something that breaks me to my core to this
Right.
day.
'Cause it's avoidable.
100% avoidable.
Like
And
no kid should be in the hospital for that or die of it.
I agree 100%. And so a couple things that I always tell families and I teach families about is there has to be multiple barriers to protection in the water. My biggest piece of advice, and this may be totally controversial, so I apologize ahead of time if this is a controversial matter, take off your kids' floaties. No child should have a floaty in the pool. Why? Life vests are intended for rocky waters, the ocean, boats, high, fast speeds. When you're at the pool with your children, they should not have floaties on. The reason why is because floaties create the biggest false sense of security of anything else in the water. It teaches them to be in a vertical position, which is a drowning position, versus a horizontal position, which is a floating position. Floating means breath, vertical means drowning. Okay. And so with your kids in floaties, it gives them a false sense of reality when it comes to the water. And it makes them think that they're safe in the water. They can go in without mom and dad being present. They're buoyant. They have buoyancy. It's a fun time. It's exciting. They get to swim across the water, right? But it's teaching them how to be vertical instead of horizontal, which is what, unfortunately, is the reason that so many kids come in and the story is always the same. Kid was in the water with mom or dad wearing floaties. Kid got out, wanted a snack. Mom went to the restroom. Don't move. Stay and eat your snack. I'll be right back. Kid forgot that the floaties were off. Kid went into the water, was found at the bottom of the pool. And it's honestly, I can't tell you, like 8 or 9 out of 10 times, it's that story. They had floaties on. They got out for a snack or a potty break. Floaties came off. Mom stepped away for a second, told the kid not to move. Kids don't listen. If you don't know that, they don't listen. And kid went back into the water and unfortunately was found too late. And so my biggest piece of advice is, if you are going to be in the water and you are taking your kids to the pool, be in the water with them. Get in there, hold them, teach them that the water is a scary place, and establish boundaries. You are not allowed to be in the water without mom or dad in there with you. So take off your floaties if you have them, take them off. Number 2, get involved in a swim survival course. So I put both my kids through a survival swim course called Infant Swim Resource. It's nationwide. You can find a local instructor in your area. If you have any questions, feel free to reach me via Instagram or on my website, because I would love to give you resources for survival swim courses. So get your kid in a survival swim lesson. Number 3 is, I mentioned earlier, multiple barriers when it comes to water. So if you have a pool in your backyard, get a door lock on your slider that leads to the backyard. Put a door alarm on your door that leads to the backyard. Put a fence around your pool. Put an alarm on that fence. So there's multiple barriers that kids have to pass before actually getting into the water is a huge one. And then my last one is, again, taking a CPR course, because God forbid your kid does end up in the water. Knowing how to help them in that acute moment and hope to revive them, I think is very crucial as well.
Yeah, thank you for that. Terrifying and avoidable. So we hope that this education could, even save lives.
Totally.
All right. Well, this has been so enlightening. I think that parents will really appreciate all this education. As pediatricians, in office, well visits are the time to educate and give them this knowledge. There's just never enough time for it. And there's always so much information to give. So a separate kind of education like this is just so needed and appreciated. So thank you. Can you tell us where we can learn more about all that you're doing?
Yeah, absolutely. So, first of all, you can get a hold of me through Instagram. So my Instagram handle is at the.medical.mamas, MAMAS, or you can check out my website, www.themedicalmamas, again, MAMAS.care. And I have 3 options of taking my course. So number 1, if you are based in Southern California or Orange County, that's where I'm at. And I host private in-home courses. So I call it's like a Tupperware party, but you're learning life-saving information. So you get a group of your friends or your family or your neighbors together. I come to you, I bring my clipboards and my magnets, and we go over my entire course covering CPR, choking, and the pediatric 101 course. So that's option number 1, private and home. Number 2 is a community course. So about once a quarter, sometimes a little bit more often, depending on the need, I will rent out a space and I will fill it with strangers. But you guys are all in the same season of life and you all have the same hopes and desires to have this life-saving information. And so I host a community course where, like I said, I fill a room with moms and dads and aunts and uncles and grandparents and nannies, and I go over my entire course. So that's your second option. And then your third is an online virtual course. So the difference between the virtual and the in-person is really just that you don't get your hands on the mannequins, which is very important. But again, knowledge is better than nothing. And people are loving my virtual courses because you get to take my course in the comfort of your own home. And so I still cover CPR, choking, and then, like I said, the pediatric 101. So those are the three options of taking my course, and all of them include an open Q&A at the end, where if you have any questions, comments, concerns about anything, even that you've experienced as a mom or as a dad in this season of life, I love to chat with families and have those open, honest conversations. And so that's how you can take my courses. To reach out, you're welcome to shoot me a DM or follow me on social media. My handle is at the.medical.mamas, MAMAS, or check out my website, themedicalmamas.care.
Awesome. Thanks so much, Shayna.
Yes, thank you for having me.
Thank you, everyone, for listening. I hope you learned a lot. I certainly did. Thank you, Shayna, so much for your time. Stay up to date with everything in children's healthcare. You can listen to Blueberry Pediatrics podcast on Apple, Spotify, or wherever you get your podcasts. We'll see you next time.